Hello learners and viewers. Welcome to this session today. The topic for this session is the concept of mind and mental health. This is part of your postgraduate diploma in mental health program, and this is part of your course EMPC-051, that is Fundamentals of Mental Health. As you know, the PG Diploma in Mental Health, the PGDMH program, it has 4 theory courses and 1 internship courses. As you can see here, the first course is EMPC-051, that is Fundamentals of Mental Health, EMPC-052, that is Mental Disorders, EMPC-053, Mental Health in Special Areas, and EMPC-054, Services for the Mentally Ill, and EMPC-A-055, that is your internship course. The topic that we have taken today is part of your first theory course, that is EMPC-051, Fundamentals of Mental Health. Now, as part of this, we are discussing today the topic concept of mind and mental health. The EMPC-051, this particular course has 4 blocks, and in each of these 4 blocks we have 4 units. So in total you have 16 units or 16 chapters as part of your EMPC-51 course. And in this particular course you will be learning about the concept of mind and mental health. You will also learn about the concept of normality and abnormality, the different psychological theories that are part of that helps explain mind and mental health. That will be covered as part of your EMPC-51 course. And you will also be learning in your EMPC-51 course about the different factors like the role of family, peer group, culture, society, how all of these factors influence our mind and our mental health. So in all these 16 chapters or units that we have as part of EMPC-51 course, you will be learning about all this. Now coming to the particular session today, the topic concept of mind and mental health, let us see what are the points that we are going to cover today in this session. Now in this session we will be learning about the meaning of mind and mental health. We will also cover like how body and mind, these are interrelated. Okay, and as part of this we also will cover different factors that affect our mind and mental health. And when we talk about mental health, how do we know that there are issues related to mental health? So the signs and symptoms, that also we will discuss, and certain myths or misconceptions that are that usually comes when we talk about mental health. That also we will touch upon in this session, and finally we will cover about the different measures that can be used to promote mental health. Now before we begin about mental health, let us see how do we conceptualize health. Now the World Health Organization, WHO, it has said that health is a total well-being. It is a state of complete physical, mental as well as emotional well-being. So here when we usually talk about health, usually we focus on the physical health aspect. But if you see this particular definition, WHO's definition of health, it focuses on the totality of health. That is, it is covering the physical, mental as well as social health and well-being. Okay. So it is not the absence of any physical disorders only. Okay. So it is not the absence of any physical disease or absence of infirmity. That is why it is like, for example, if a person is not having any physical disease, then we cannot say that the person is physically fit, because all the physical parameters of the person that might not be up to the optimal level. So in that sense, even if a person is not having any physical disease, that person might not be considered as being physically healthy. So that is why the WHO's definition, it says that it is not merely the absence of any physical disease or infirmity. Okay. So that means we need to focus beyond the absence of any physical disease or disorder. Okay. Now having known, after we discussed about the definition of health, let us see how do we define mental health. Again, WHO has given this definition of mental health. WHO says that mental health is a state of well-being where the individual can realize whatever the abilities the person has, Also, the person is able to cope with the normal day-to-day stresses of life, and the person is able to work productively, and the person is able to contribute effectively to the community. Now, when we see this particular definition here, the definition of mental health, it is not talking about any kind of mental disorders as such. So that means when we talk about mental health, mental disorders are there, but we also need to focus on the other aspects, that is the promotive aspect and the preventive aspects. Okay. So here in this WHO's definition, it is focusing on the promotive aspect of mental health, that what all we can do to promote our mental health and to prevent mental health issues coming up. So that is where it says it mainly focuses on 4 aspects, that is whatever the capabilities the individual is having, those capabilities need to be realized, need to be used by the individual. The person should be able to cope with the daily stresses. Like in our daily life, we face so many types of stresses. That is part of our day-to-day life. So those normal stresses of life, if the person is able to cope or not, so that also indicates mental health. And then the person is able to work productively. Contribute something, create something, and then contribute towards the community welfare. Okay. So community participation and contribution to the community, that is also a part of the when we talk about mental health. So WHO's definition, it focuses on the promotive aspect of mental health, and if we focus on these 4 aspects, then this will help us to develop capabilities and develop mental health and well-being. That will help us in leading an effective life. Okay. Yeah, okay. Yeah, hello.
हाँ मैम, गुड आफ्टरनून.
Yes.
मेरा नाम आशुतोष दुबे है. मैंने MAPC में मेरा सेकंड ईयर में मैंने री रजिस्ट्रेशन किया था. तो उस टाइम पे ये MAPC मतलब इसका इंडस्ट्रियल वाला सिलेक्शन करना था. तो बाय मिस्टेक मैंने 15 वाला सिलेक्शन कर लिया प्रोजेक्ट का. तो मैंने कई बार रीजनल सेंटर में बात किया, जो अमेंड नहीं हो पाया है मैम. तो इसी रिगार्डिंग मुझे बात करना था मैम.
ना, इसमें आपको जो कंसर्न डिवीजन है, ओके, जो एडमिशन प्रोसेस देखते हैं, उन्हीं को आपको कांटेक्ट करना पड़ेगा. एंड रीजनल सेंटर से कांटेक्ट करके आपको एक कर सकते हो. आपका बस टाइमलाइन देखना पड़ेगा.
सुनिए मैम, लिसन टू मी. जो NAP के थ्रू है, NAP में अभी जो चेंजेस हुए हैं, तो NAP के एक रिकॉर्ड मैंने अकॉर्डिंग देखा जाए तो ये तो जब मैंने स्टूडेंट सेटअप बाय मिस्टेकली हुआ है, तो स्टूडेंट के सपोर्ट में ये चीजें होनी चाहिए एज पर NAP मैम.
हाँ, इसलिए मैं बोल रही हूँ, आप एक ईमेल हमें लिख सकते हो, एंड ईमेल में फिर हम जो कंसर्न डिवीजन है उनको कांटेक्ट कर सकते हैं कि क्या इसमें पॉसिबिलिटीज है. ठीक है
जी. ईमेल ID बताइए मैम.
ईमेल हमारा वेबसाइट में भी है, psychology@ignou.ac.in. प्रोस्पेक्ट आपके प्रोग्राम गाइड में भी दिया है, बुक्स में भी दिया है. ठीक है.
ओके ओके, थैंक यू सो मच मैम. थोड़ा सा सपोर्ट चाहता हूँ मैम.
ओके, थैंक यू. Yeah. So as we were discussing about the definition of mental health, this is mainly focusing on the promotive aspect of mental health. To further elaborate on this particular definition, we can also see this particular continuum that we talk about when we discuss about mental health. This indicates that there is presence of disorder, then there is absence of disorder, and then there is optimum level of living. Now, earlier as I was giving you the example of health, and then I was talking about the presence of physical disease. So similarly, when we talk about mental health, it is not merely that the person is having any kind of mental disorder, and there is absence of mental disorder, the person is not having any kind of mental disorder, then do we say that the person is mentally healthy? So here the question is that even if the person is not having any kind of mental disorder, still the person may not be mentally healthy. Okay, because in this continuum, if we see, we move beyond the absence of mental disorder. Okay, moving beyond the absence of mental disorder, we talk about the presence of optimum level of living. That is the presence of a flourishing state of well-being. Okay. So our goal when we talk about mental health, it is reaching that optimum level or the flourishing state of well-being. Okay. That will indicate a good mental health or a positive mental health. So it is not merely the absence of any kind of mental disorder that will indicate mental health, but the mental health is indicated when we reach that highest level, that is the optimum level of living, which we usually say as the flourishing state of well-being or the positive mental health. Okay. Now, so when we talk about mental health, it usually involves various things, like it has its autonomy, a sense of empathy, positive emotions are there, then emotion regulation is there, effective coping is there, resilience is there, there is good interpersonal relationships, contentment is there, subjective well-being is there. So all these things need to be present. So that is why again I'll highlight here is that even if the person is not having any kind of mental disorder, still the person might not be mentally healthy because all these factors need to be present in the person's life. There needs to be resilience, there needs to be presence of positive emotions, there needs to be autonomy, sense of autonomy, there needs to be effective coping strategies. So all these things need to be present in the individual's life. That is a subjective state of well-being, and all these things will lead to the positive mental health condition and flourishing state of well-being. So here again I would like to highlight is that when we talk about mental disorders, it basically involves severe disturbances in emotions, in thinking and in behavior. Okay, so these are the three main aspects: thinking, behavior and emotions. So severe disturbances related to all these three aspects, that indicate certain kind of mental disorders. So when we talk about mental health, we need to distinguish this, that there is, on the one hand there is mental disorders, and on the other hand we talk about the promotion of mental health. The disorder is not there, but still we need to focus on the promotion of mental health, and we need to focus on how to prevent mental health related issues. Okay. Now, when we are discussing about mental health, definitely there is mind and there is body. Okay, so this mind and body, these are interrelated. And like whatever mind refers to your cognitive functions, your thinking and other aspects, emotions. So our mind affects our body and our body affects our mind. So that means there is this interrelationship. And when we talk about Indian thought system, we talk about Pancha Mahabhut, where we talk about the 5 levels of the mind, which says that the individual is made up of 5 primary elements, that is air, fire, ether, water and earth. Now these 5 elements, these are the basic elements of our existence, and these interact with each other. And the proportion of this, that leads to different types of health conditions in the individual. Taking all these things, the Ayurveda, they have defined the body and mind relationship in terms of 3 dosas and 3 gunas. 3 dosas refers to the Vata, Pitta and Kapha, where these elements that are there, the imbalances or the quantity of these elements, where it is more or where it is less. So that determines what kind of diseases the person might be having. Okay. So this also affects the functioning of the mind of the individual. So the disturbances or the imbalances in this Vata, Pitta, Kapha, that results from the imbalances in the bodily elements, that also impacts our mind and mental functions. Okay. Similarly, Ayurveda also talks about 3 gunas, that is Sattva, Raja, Tama. These are the personality characteristics, these are related to the personality characteristics of the individual. So that also affects the kind of qualities the person is having. That also impacts the functioning of the individual. Okay. So in the Indian system, the Ayurveda and other systems also, they talk about how our bodily functions, physical related functions affect our mental functions, mental functioning, and then how our mental functioning, that also influences our bodily functioning. So there is interrelationship, and ultimately this interrelationship affects our mental health and well-being. Okay. Like if you take a common example, like if you are not feeling well, like you're having like a cough and cold or feverish, then you're at the mind level also you feel irritated, you feel irritated at small things. So your body and mind are related, interrelated, and this affects our mental health also. Okay. Now when you're talking about this body mind in relationship, there is this also, the Indian thought tradition also talks about the panchakosa. In panchakosa theory, it talks about that there are 5 layers like annamaya kosa, pranamaya kosa, manomaya kosa, vijnanamaya kosa, and anandamaya kosa. Yeah. So these 5 kosas, okay, it refers to different aspects of our health. Like the WHO's definition of health we have talked about earlier, where it is saying that it's a complete physical health, social and emotional health. So here also when we talk about this Indian thought system, the Panchakosa theory, here also it talks about various aspects of our health. The Annamaya Kosa and Pranamaya Kosa, it talks about the physical health and well-being. Okay. Manomaya Kosa, it refers to your cognitive aspects. Vijnanamaya Kosa also, it refers to your cognitive functioning, okay, the higher intellect and intuition and insight aspects. And Anandamaya Kosa, it refers to the transcendence or blissful state of well-being. So this particular approach, the Panchakosa approach, it also focuses on our physical health, emotional health, mental health, psychological health and well-being. So it is a overall approach it talks about when we talk about health. So this also, when we talk about mental health, we also need to focus on this particular theory. Now, when we talk about mind-body relationship and the mental health, there are various factors that affect this, and we usually talk about the bio-psycho-socio-spiritual model of mental health, where it highlights that there are biological aspects affecting our mind and mental health, there are psychological aspects, socio-cultural aspects and spiritual aspects. So all this affect our mind functioning as well as mental health. Like the Panchakosa that we were talking about earlier, there also we talk about the spiritual aspect. The Anandamaya Kosa, it talks about the highest state of well-being. So this biopsychosocial spiritual approach, when we talk about, the spiritual approach is also taken care of when we talk about the Panchakosa theory. Okay. So it is a holistic approach to the functioning of the mind or the body-mind relationship or the mental health that we talk about. We need to focus on this holistic approach, taking the bio-psycho-social and spiritual approach. Okay. Like for example, when we are talking about biological factors, okay, there are different factors that we talk about here. The genetic factors, of course, are there. The physical health related factors, the brain functioning, there is sleep, exercise, diet, the kind of food that we are eating. So these are very important when we talk about biological factors. Similarly, psychological factors, when we talk about the thoughts related, the thinking related factors, that is are related to belief system, our attitudes, values or perception. So these things affect how do we think about a particular thing, and that also, our thoughts can create anxiety, our thoughts can create positive emotions, our thoughts can also create a resilient attitude. So this way our thoughts, our emotions like fear, anxiety and all these things can affect our functioning of the mind, and they can impact our mental health and well-being. Okay. For example, like the feeling of lack of control in a particular situation, like if there is an emergency situation or there is a trauma or accident or any kind of disaster situations, some individuals feel a sense of lack of control over that particular situation. So that also can create stress and affect our mental health and well-being. Similarly, the social factors like the family situation, the relationship factors, the peer group, the workplace related factors, the environment related factors, the socio-cultural factors. Okay, these are also important because our cultural beliefs, that also impacts our mental health. Different cultures have different kinds of beliefs, and human behavior is usually influenced by the particular cultural background. Okay, so that is why it is very important to know about the kind of socio-cultural background from which the person is, because those socio-cultural factors also impact the way the human mind functions and the mental health of the particular individual. Okay. Now, having discussed all these things, let us see, when we are talking about mental health, how do we know that there are mental health related issues? There are certain signs and symptoms related to mental health issues. So, physical symptoms can be there is lack of sleep or lack of energy or fatigue, there is nausea or palpitations. These kind of physical sensations might be there. So then there is cognitive symptoms, like the person might be having negative thoughts or lack of focus or concentration, a feeling of guilt or resentment. Similarly, emotionally, the person might be feeling anxiety, fear or sadness or nervousness. So these are related to the cognitive and emotional symptoms. Similarly, there are certain signs or symptoms related to the behavior also, like the person feels lethargic, the person is very aggressive, okay, or the person engages in destructive behavior, or there are certain changes in the eating pattern or sleeping pattern, okay, or there are major changes in the personality and behavior of the individual. So these are the various signs related to the physical, emotional, thought and behavioral aspects. Now we need to be vigilant about these signs and symptoms. Now, just because these signs and symptoms are there, does it qualify that the person is having mental health issues? It might not be, because we have to see that what is the duration of these symptoms. Okay, so there are these four aspects that we need to focus on. What is the duration of these symptoms? What is the intensity or severity of these symptoms? Then what is the frequency of these symptoms, and how these symptoms impact the day-to-day functioning of the individual. So just because, like for example, if a person has not slept, the person might be having a headache or might feel irritable. So just because these symptoms are there, that doesn't qualify that the person is having certain kind of mental health issues. So these four aspects we need to keep in mind: the duration, the frequency, the intensity and the impact on the daily functioning of the individual. Okay. If this is really affecting the individual and is occurring over a longer period of time, the severity is more, then we need to be concerned about the person might be facing certain mental health related issues, and it is better to talk to about this particular, and if required, mental help taken. Individual, they face certain kind of mental disorders. Okay. And 1 in every 5, they face certain kind of symptoms related to mental health issues. And majority of the mental disorders, it starts like 50% of mental health conditions, it starts by the age of 14. Okay. And the common mental disorders like anxiety and depression, they account for 40% of mental disorders. So it is really important that we need to focus on how our mind functions, how mind and body, there is an interrelationship, both influence each other, impact each other, and how all these things impact our mental health. Okay, because mental disorders are increasing and we need to focus on the functioning of our mind and mental health. And as I said earlier, mental disorders are there, but along with this we need to focus on the promotion of mental health and the prevention of mental health issues or mental health related problems. That will take care of our mental health. Okay. Now, when we are discussing these things, we also can focus on that there are certain myths and misconceptions also related to how our mind functions, or what are the misconceptions related to mental health. Usually it is thought that mental health conditions, they do not affect children or adolescents, but the data that I just quoted, it says otherwise. Okay, because majority of the disorders, they start at an early age. Also, it is said that mental health conditions occur to those who are having weak personality or who lack willpower. Okay, Also, it is said that mental health conditions affect those who come from the lower social economic background or those who are having low intelligence. Okay, but it is nothing like that. These all are misconceptions. Okay, because mental health conditions can affect anyone, irrespective of age, irrespective of gender, irrespective of the social economic background. Okay. So, it is very important that we need to focus on the how our mind and body functions and how these are interrelated and how we can take care of our mental health. Now, when we talk about taking care of mental health, we need to keep in mind certain things. Okay, so for this we can say that we need to focus on the individual level, we need to focus on the community level, and we need to talk about the policy level also. Okay, because these are the three fronts. If we focus on these, then definitely we can take steps to promote our mental health and well-being. Because mental health is also emphasized as part of the Sustainable Development Goals. Okay, the SDG goals also recognize the importance of mental health, and mental health is also considered as a fundamental human right, and it requires a rights-based approach. Okay, because mental health of the individual, it is unique. It is impacted by a variety of factors, including the biological, the social, the environmental factors. So we need to keep in mind all these aspects. Okay, and that is why a multi-sectoral approach is very much essential when we talk about mental health, where we can talk about taking like self-care initiatives, informal support by the family, by the people around us. We also talk about the community-based mental health services. There are digital interventions also that can be made use of to create awareness about mental health. Then the life course approach, that is, we need to focus on mental health right from the beginning, from the young age, childhood till the old age, across all the developmental stages. Okay, so that is why mental health needs to be integrated with the primary health care services. And of course, there is a Mental Health Care Act 2017, which highlights the importance of mental health, which highlights the different services that can be provided to people to for their promotion of mental health and for the treatment of mental disorders. Okay, so learners, we discussed today about the concept of mind and mental health. And at the end, we can simply focus on, when we are talking about mind, body functioning and the promotion of mental health, we can focus on these 5 mantras that we can talk about, where eat well, sleep well, exercise well, think well and connect well. If we focus on these 5 aspects, this will definitely take care of our physical health as well as social, emotional health and spiritual health, which the WHO's definition of mental health also focuses on a holistic approach towards mental health. So thank you, learners, and for any suggestion and any queries, you can always contact us on this email ID swatipatra@ignou.ac.in and also on PGDMH SOSS@ignou.ac.in. Thank you.